Hello, this is Dr. Wells from Wells Medicine, and I know you're excited to come in and get started with your ketamine infusion series. In this third video, we're going to be continuing with what to expect as you're moving through the ketamine infusion series. Some things to be looking out for, some things to be watching for with the progress of your treatments, some things you can be adding and subtracting to help increase the benefits of treatments, and we'll start thinking about what maintenance might look like. So during the first infusion, we talked a little bit about supplements. So when you come in for your third infusion, we're going to check again to make sure that you're taking your zinc, your magnesium, your vitamin D, and your L-methylfolate. During the second infusion, we talk a little bit about getting outdoors, exercising a little bit, and we're going to be checking to make sure that you're starting to think about how you can adopt some of those healthier habits. At this point, it's not necessarily that you're running a 5K or that you're going to the gym every day. It's just important that you start thinking about what you need for that. Do you need gym shoes? Do you need workout clothes? How can you arrange for those sorts of things? And starting to think about how you're going to start adopting the habits of going outdoors every day and fit exercise into your daily schedule. During the third infusion, again, we're going to want to know if the dose was floaty during the second infusion, whether you feel like you want an adjustment up or down on the dose, if you had any side effects like nausea or headache after the second infusion, and if your family has started to notice that there are any changes. By the third infusion, that's when families have already noticed, and sometimes patients have noticed by now, that they're starting to feel a little bit better. Things just aren't as much of a chore as they used to be. And this is a great time to adopt some healthier habits and kind of change any maladaptive coping strategies. During the third infusion, again, we're going to try and keep things as nice and quiet and calm as possible. This is a time when if you change music between your first and your second, really trying to find the kind of music or the kind of video that you want to be continuing to watch during the rest of your ketamine treatments. Just like Pavlov with his dog experiment, people become acclimated and trained to the music and the mood that that music puts them into. So if you're finding a music or a movie that really makes the experience great and you're having pleasant, relaxing, floaty feelings, we want to use that for your benefit by allowing you to have that to listen to at home and really kind of solidifying that this is what's associated with those pleasant and floaty feelings. So this is a great time to kind of lock in on your music. This is also a really good time to think about adopting habits of meditation or prayer. Almost all religions in the world come to sort of a contemplative philosophy at some point. And so we really feel that it's valuable to humans to have that little bit of a space to either do mantras or breathing techniques or some kind of meditation and prayer. That can be walking outside without your phone or music. That could be listening to commencement speeches. It could be sitting on a pillow doing a perfect 30 minutes of Om and mantras in the yogic techniques. It could be almost anything that really speaks to you. But we want you to start playing this week with things that different techniques of breathing or meditation to find one that really speaks to you. Because I don't want you to be doing it just now for the homework Dr. Wells gives you. I want you to be doing it for 3 months from now, 6 months from now, something that you're really looking forward to every day. Something that gives you a little bit of space, a little bit of calmness in your day. And there are all kinds of flavors. If you're a Christian, if you're Buddhist, if you're Muslim, if you're Hindu, if you're an atheist, if you're just kind of blandly spiritual, there are some of these in the new patient packet that we give you, and you can find many, many more of them on YouTube. It's the Baskin Robbins of meditation now. There's really so many different flavors. I just really want to invite you to try and find one that works for you. So that's kind of things to be looking for after your third infusion. We'll continue watching your quick inventory of depressive symptoms. We'll continue looking to see if there's a dose adjustment that we can make, and we'll continue kind of asking you, are you noticing any changes? You were looking last time a little bit at caffeine and sleep, and so this would be a great time to kind of look and see if you can decrease any of the caffeine intake. See if that doesn't help with any of the jitteriness or the anxiety. See if that's correlated in any sort of timeline to anxiety that you have. In the lab, in order to induce the feelings of anxiety, they actually give subjects caffeine. And if you've ever had personally the unpleasant experience of drinking too many cups of coffee, you'll know that heart rate, racing, palpitations feeling that too much caffeine can give you. And so, thinking about, and I'm not asking anyone to get rid of their coffee. I certainly would never survive without my coffee, but thinking about decreasing it as much as possible or moving it as early in the day as possible is a really good first step. I hope these videos are useful in preparation for coming in for ketamine treatments. And if they are, please let us know by liking, subscribing, leaving us some comments. Let us know what would be more useful for you to have information about. And I hope to see you in other videos.